All right, so you're going over endocrine stuff today, all right? If you are one of those people that are looking like at the syllabus, there's like 2 of you that ever look at it for some reason, you'll notice it's a little bit different. I cut out a couple of things on here, okay, just because it's repeated and somehow got in the wrong place. All right, so we're going to look at all these different conditions, diseases. You're going to see that these are kind of big deals. Okay, a lot of them, they happen a lot. So, without further ado, okay, let's just start out with the pituitary. Yes.
Oh yeah, it's on the calendar. No, it's on the calendar, but it's on the last second. It's for last second.
Oh yeah, I think I put it due Sundays. Or start Sundays instead of Monday. So yeah, I'll look like the week ahead because I might have it earlier. All right. So anyway, you've done. I'm watching. Okay. So anyway, pituitary adenoma. Okay. Again, anytime you see the word "oma" on the end of a word, that means growth or tumor. Okay. So this is a growth or tumor inside or on the pituitary gland. Okay. If you remember your anatomy, that pituitary gland is about the size of an M&M. Okay. You can only have so much growth on that thing, and when you do, you guys will also remember there are a lot of hormones that pituitary gland is responsible for. Okay. Now, obviously, we're not going to go through all of them. That was your Bio 202 class. We are going to, again, remind you of some of them and some of the conditions that present with pituitary adenomas more commonly than other ones, okay? So for example, the top 3 hormones that are produced from pituitary adenomas are ACTH, and we'll look at that, prolactin, and growth hormone. Okay, so those 3 are by far the most common hormones secreted from a pituitary adenoma. And one thing about pituitary adenomas is they tend to over-secrete hormones. Okay, tumors sometimes do that, as you saw with that bronchogenic tumor with ADH, right? You can check out those videos if you want, but as you can see, there's not a lot of room in the brain for any extra growths, and that includes around the pituitary gland. They can cause, this kind of symptoms you might guess, right? When you start having growth inside of your brain of any kind, you get that increase in your cranial pressure, and it might mess with your vision, and depending on where it is, it could cause other problems, including like headaches, of course. The easiest way to get to it is right up the old nose and through that cribriform plate. Okay? You remember your anatomy, that's pretty fragile, and that's the most direct route to get to the pituitary gland is right up through the nasal cavity. If you think about it, it's at the base of the brain, at the bottom of the brain, kind of hard to get to. Okay? So that's kind of how they do it. They just kind of shove the old thing right up the nose and cut it out. Okay? Sometimes they'll take it off, sometimes part of it, just depends on the particular person. Okay? Again, this is what I was talking about. These are the top 3. Okay? Prolactin. You guys remember what that does?
Produces milk.
Produces milk. Okay? So this is male or female. Okay? You get a pituitary adenoma that's secreting prolactin. A lot of times we'll call it a prolactinoma. Okay? It's the same thing. It's pituitary adenoma secreting prolactin, a prolactinoma. Okay? That in itself is 30% of all pituitary adenomas. Okay? So again, male or female, you're going to start secreting a bunch of milk like you're nursing a baby. Okay? ACTH is the other one. ACTH, as it says there, causes Cushing's syndrome, but what does ACTH stimulate?
It's adrenal or
Okay. Adrenal cortex, the corticotropic hormones, cortisol, right? That's your what hormone? Stress hormone, which will cause what we call Cushing's syndrome, and we'll see that in a minute. Okay, it makes you very cushy. Okay, and of course, growth hormone, you guys know what that does. Okay, the reason we put acromegaly up here instead of gigantism is because most of the time when people are getting these tumors, they're mostly adults. Okay, after their growth plates have closed, and once your growth plates closed, as you know, you don't grow tall anymore, you just grow wider, your bones get thicker, and that's acromegaly. Okay? Any questions on any of that?
does this affect the gland like directly?
What do you mean, does it affect the gland
Like,
directly?
is the tumor on the gland
Yeah,
from
it
these
goes in the
conditions?
gland. Uh-huh.
Okay.
Yeah, if you look at that, it's kind of hard to tell them apart a little bit. Where you look at that, it looks like the pituitary gland, but there's, some of that is the actual pituitary, and some of it's the growth on the pituitary. So yeah, it grows kind of in and on the pituitary gland itself. Okay? So hey, those are the big three that will cause that. This is a good description of Cushing's syndrome. We'll have a lot of slides here about Cushing's syndrome. Again, it makes these signs and symptoms because it is ACTH in this case. By the way, you get Cushing's syndrome from another cause other than a pituitary adenoma, okay? But ACTH, in this case, oversecreted, which means it oversecrete cortisol, which is our stress hormone, which is gonna give you that big fatty deposit in between your shoulder blades. They call that buffalo hump sometimes, okay? That rounded face, a lot of times we call that moon faces or moon faces. I'm not sure why they go with faces instead of faces. Or it's either moon face or moon faces. I don't know why it's faces. Apparently it's some kind of weird grammar thing, I don't know.
Rolls off the tongue better.
Huh?
It rolls off
It
the
rolls
tongue
off
better.
the tongue better than moon faces. I don't know. Either way. So, again, round the face, moon face, stretch marks, because you're gaining weight. Just like a pregnant lady gains weight with stretch marks, same thing with people with Cushing's. Okay? High blood pressure, again, this is the stress hormone. It's supposed to do that. It's supposed to raise your blood pressure. It's supposed to also raise your blood sugar. Okay? That's why it can sometimes lead to diabetes. Bone loss, instead to leach calcium from your bone, again, you're going to need a lot more of it when you're in constant stress. Okay? So there it is. No, that is not a drawing of me. That is drawing of somebody else. Okay? Again, all of these symptoms have to do pretty much with too much cortisol. All right? You get most of these things, I don't know how you end up having thinning of scalp hair with too much cortisol. I guess there must be some truth about people being stressed out and pulling their hair out. I thought that was an old saying, but there must be some truth to that, because they do lose hair for some reason. Okay? Some of these symptoms, like the slow healing of cuts, thinning, fragile skin, those are diabetes-like symptoms. Okay? Again, even if somebody with Cushing's doesn't get diabetes, that doesn't mean that that high blood sugar that they have doesn't cause diabetes-like symptoms. Okay? You'll also notice like increased facial hair, male and female. Okay? So this obesity, fat deposits, you'll also see weight gain. Not here, but on another one, you're going to see irregular menstrual,
Oh, wow.
irregular or absent menstrual periods. A lot of these, by the way, sound just like polycystic ovarian syndrome. Okay? So Cushing's and PCOS, if you think it's one, you should probably throw the other one as a differential. Okay? they are very, very similar as far as their manifestations go clinically. However, in PCOS, there are no cognitive difficulties. There's no problem thinking. Okay, it's just completely unrelated. Depression, anxiety, irritability. I don't know how to spend too much time on that. You're going to get that with pretty much any disease somebody gets. They kind of get depressed or anxious, or but a lot of that I think stems from just the body trying to react to that stress hormone constantly being present. Okay? And as you guys probably already know, of course, that increased cortisol, the way that you gain weight from that, again, it's a stress hormone. You want to, your body thinks because I'm in stress, there must be some kind of famine, and therefore the body's going to store fat really easily. It's going to constantly keep your blood sugar high. It's going to make it so that you're always not necessarily fight or flight, not like, the adrenaline fight or flight, but kind of up as far as, getting your energy, sugar in your blood so you can use it for energy, that sort of thing. So there are a lot of clinical signs and symptoms that would explain all of these. Well, I guess the point of the stress hormone explains the clinical signs and symptoms, is what I'm trying to say. All right. Any other questions on that? That facial hair? I can't say that word.
What about age?
What about age?
When does this affect you, most likely?
When does it affect you? I don't know that there's an age on this. Again, most of the time we see them in adults. I don't think I've ever seen one in kids, but man, on the litter I've only seen a couple times where it was because of a pituitary adenoma. And geez, one was about 30 and the other person was like 45. So I don't know what the stats are on it. But again, you can get Cushing's not from other reasons other than just the pituitary adenoma. Okay, this one is caused specifically because of that increase in ACTH, overstimulating it. Okay? Please.
From a nursing standpoint, with this one, with Cushing syndrome, you're going to be seeing, like Dr. Sillanpaa said, diabetic kinds of signs and symptoms. So more than likely, you'd be checking that glucose level. And then the big thing too is the fractures. Something, depending on how long that person has had Cushing syndrome, simply like shifting can cause them to break a bone. So even though they might look all right, you always have to constantly be repeating that if you need to get up, ask for help, because there's been instances where just simply getting up and wanting to go to the bathroom by themselves, they break a bone, because that's how badly bone loss they've had. So osteoporosis.
Yeah, you don't want somebody to break a bone on your watch as a nurse. That's uncool. Okay.